We've talked about it here on this program. Over the past year, we've seen COVID cases surge after just about every holiday. With so many of you on spring break right now, I asked Piedmont Healthcare's Dr. Jane Morgan whether we should brace for a surge or if vaccine rollout will break that pattern.
So one of the things we have to remember is that 75% of our population is 65 years of age and older have already been vaccinated. So we are expecting not only a surge in COVID cases, but a surge in younger COVID cases, people who are on spring break, but also have not been immunized. And so this is what we are expecting, and this is what we are preparing for.
All right, but they don't get really sick by majority, of course, there are exceptions. They kind of handle it. So are we better off with this kind of surge, or is there no such thing as a better surge?
So I think when we think about the long haul syndrome, there really is nothing to be said with a better surge or worse surge, because don't forget, 30% of people who are infected with COVID, regardless of your clinical course, will go on to develop this long haul syndrome where you have these lingering, sometimes fairly debilitating symptoms months after your initial infection. And we are unable to identify who those people will be, and we're unable to prevent it.
And again, really quickly, 10 seconds. What do we do? Do we not go to work for a week after we come back? Do we not take the kids to school? Do we mask up? What?
So when you come back, still follow all public health measures. Unless you're symptomatic, you need to be tested and quarantined, or if you have been exposed to someone with COVID. Otherwise, you are to continue to wear your mask, continue to wash your hands, to continue to practice social distancing and follow all public health measures and recommendations.
Dr. Jane Morgan, Executive Director of the COVID Task Force for Piedmont Healthcare. Congratulations on the promotion, and always great talking to you.
Thanks, George.